Do you know that cholera can lead to severe dehydration and can even take you to your grave if left untreated? I'm Baba. You can call me Nest Baby. Please follow, like, and share my videos. Today, I'm going to talk about cholera. And cholera is an acute diarrhea disease caused by a bacterium named Vibrio cholerae. It is transmitted or spread through food and water. This disease causes sudden profuse watery diarrhea that can lead to severe dehydration and can even take you to your grave within hours if not treated promptly. What happens is that before somebody develops cholera, it means the person has eaten food or water contaminated with an infected person's feces. Either the person shake hands with an infected person who after visiting the washroom didn't wash his or her hand, or maybe a house fly going to sit on an infected person's feces and then coming back to sit on your food which was left uncovered. As I said earlier, cholera is caused by a bacterium named Vibrio cholera. But then we have risk factors which can bring about cholera. Drinking water which is contaminated with the virus Vibrio cholera, or eating food which is also contaminated with the virus, and poor sanitation. Maybe you have choke gutters around your house and poor personal hygiene whereby you don't wash your hands after visiting the toilet or shaking hands with people after touching contaminated surfaces. We also have open defecation whereby there is no proper structure for people to defecate there, but they rather defecate around at the back of houses, in gutters, and other places. Flooding and natural disasters, living in an overcrowded areas or refugee camps, poor waste disposal, refuse anywhere we like without proper care. And when we lack access to clean water, all these factors can put us at risk of developing cholera. So let's move to the signs and symptoms of cholera. When you start seeing these signs, you need to rush to the hospital for further investigations. Some of the signs and symptoms are sudden onset of profuse watery diarrhea, passing out rice water stool, vomiting, you having muscle cramps, and you develop excessive thirst. You also have dry mouth, sunken eyes. Just say when you see to poor skin tego, your skin doesn't easily go back after pinching it. And then you also become weak. You have a rapid pulse and then low blood pressure. There will be reduction in your urine output. You bring out small urine. We are going to move to some of the diagnostic investigations that we can do to diagnose you of cholera. And these investigations, you cannot do it in the house unless you go to the hospital. We have stool culture. We will take your stool for examination. We also have rapid diagnostic tests. We have stool microscopy. These investigations can be done in the hospital. Let's move to the management. With the management, you cannot do much in the house. You can only take in the ORS because you've been passing out watery stool, which can lead to dehydration. That is why you can take in the ORS. So after taking the ORS, you need to go to the hospital for better treatment. When you go to the hospital they will be giving you intravenous fluids. And now I'll say a doctor means antibiotics, then some zinc supplement. We can isolate the infected person where possible and then maintain strict hand hygiene. There should be proper disposal of stool and vomitus. Disinfect contaminated surfaces and equipment. You washing, to drink safe and treated water. You eat properly cooked foods. You don't have to eat cold foods. You have to eat properly cooked foods because that bacteria cannot stay in a hot food or in properly cooked food. If cholera is left untreated, what are some of the complications that it can bring? We have severe dehydration in your body. will lose a lot of fluids because of passing out of rice water stool, and then hypovolemic shock, where there is limited blood or fluid and oxygen to some of the vital organs, which leads to malfunction in the body. There will also be electrolyte imbalance since most of the fluids in the body are coming out. When it is also coming out, it is coming along with some of the electrolyte. You can also develop acute kidney injury, a condition of the kidney, and then metabolic acidosis, hypoglycemia. Especially in children, hypoglycemia is low sugar in the blood, and also seizures is a condition in the brain where there is electrical disturbances in the brain. So all that we need to do to prevent cholera is that we need to drink safe, clean or boiled water. We have to wash our hands regularly with soap and clean water, especially after touching contaminated surfaces, after eating, after visiting the washroom, and even after shaking hands with people. You might not know who carries the bacteria. Food hygiene. Whenever we are cooking, we need to wash our hands. We need to wash our foods, our vegetables, our fruits before we eat. We have to cook food thoroughly and eat it while hot. Then you wash your fruit and vegetables before eating. You have to use proper sanitation, fetch water from a clean source, dispose human waste safely, improve community sanitation like what we've been doing here. We have a sanitation day where workers will clean around their workplaces, making gutters clean, and we have to promptly identify and treat cholera cases because we've learned about the signs and symptoms. So you need to visit the hospital immediately, see any of the signs and symptoms. You can also receive oral cholera vaccine in high-risk areas or during cholera outbreak, especially in communities where they have low sanitation. In all, cholera is a treatable and preventable bacterial disease. So we all need to be careful and take good care of our health by practicing a proper sanitation and good personal hygiene. If you're interested in today's video, just comment next in the comment section. And Baba, you can call me Nurse Baby. But remember that your health is too delicate to be left in the hands of health professionals only. Catch you next time. Bye-bye.